fertility specialist at Iswarya Fertility HSR Layout, Bangalore. Today, I'll be briefing on male fertility, azoospermia. Azoospermia is one of the cause of male fertility. In general, male fertility accounts to about 40% of the fertility problems. And azoospermia, being one of the male factor, accounts to about 10 to 15% of the male infertility. Now, coming to what is azoospermia? It's the absence of the sperms in the ejaculated semen sample which is taken by masturbation. When do you exactly tell it is azoospermia? Yes, with 2 to 3 days of abstinence when the ejaculated sample do not have sperms, and then you need to check the semen sample at least 6 weeks apart. Then if there are no sperms even after the second sample given, that is 2 minimum samples of semen which do not contain sperm, then the diagnosis of azoospermia is made. Yes. Why is this azoospermia happens? Why does it happen? There are many causes like trauma, injury, infections, inflammations, any blockage in the outflow tract, and any surgeries, previous surgeries. All these causes may lead to azoospermia. Yes. Is the donor sperm only the treatment of azoospermia? No. 70% of the patients with azoospermia still can conceive with their own sperm sample, provided accurate diagnosis of type of azoospermia is required. There are different types of azoospermia like obstructive azoospermia, non-obstructive azoospermia. Now, this test should be complemented with a blood test like FSH, LH, thyroid test, that is TSH, and also with the transrectal ultrasonography. All put together then give us a brief diagnosis on what type of azoospermia is it. Depending on that, again the treatment plan can be done. Yes. What exactly is done in the blood test? How the conclusion can be done? It depends on the FSH factor. If the FSH is less than 20, then yes, the sperms can be retrieved from the testes or the percutaneous aspiration. If the FSH level is more than 20, then you may require the donor sperms. Coming to the FSH, if it is less than 4, the normal FSH value is between 2 to 6. If it is less than 2, yes, even after that, it is indicative of pituitary failure, wherein the treatment can be given medically by supplementing with the FSH injections twice weekly for 4 weeks and repeating the semen analysis. If there is obstructive cause detected on the scan, on the transrectal scan, then operative measures, that is the removal of the blockage, can also yield us the normal semen sample. Coming to the normal FSH and still azoospermia. Now, if the FSH is on the lesser side, yes, medical treatment with FSH injections will hold good. If there is a blockage, yes, with the removal of the blockage, that is a surgical blockage removal will be the treatment. But if FSH is normal between 2 to 6, then still there is azoospermia. Then there are procedures, that is a surgical retrieval of the sperms, that is PISA, which is called as percutaneous aspiration of the sperms, or TISA, that is testicular aspiration of the sperms, or something called micro-TISA, microscopic aspiration of the sperms. Can yield good number and the quality of the sperms. How is it done? Is it difficult? No, definitely not. It's a simple OPD procedure which is done under the local anesthesia and at the minimal cost with proper diagnosis so that we get the sperms. Yes. So finally, to conclude, azoospermia is one of the causes of male fertility in which 70% of the patients with azoospermia can have pregnancy with their own sperms with proper diagnosis and treatment, and only 30% of the patients wherein FSH is more than 20 and there is no surgical blockage, there is no obstructive cause, or even though obstructive cause may require donor sperms. Thank you.